What we can see in this image is that there is an appliance which is placed over the palatal area, which is then soldered onto the molar bands, which are then cemented in place. So what we can identify is that this is some sort of a fixed habit breaking appliance. Okay. So if you look at the options which are given, we can straight away eliminate option number 3 because we know that this is not a removable but rather a fixed appliance. How do we identify which kind of habit will it intercept? So to answer this, we need to know what is a particular requirement from any type of an appliance to intercept a particular habit. For example, such an appliance will not be helpful in case of mouth breathing. Okay, in mouth breathing, we need something like an oral screen or a vestibular screen, which is going to prevent entry of air from the mouth. Okay, and help shift the patient to nasal breathing. Okay, so it will look something like this. So here what we can appreciate is that there is a oral screen which consists of breathing holes. Okay, and there is this metal ring which is present in the anterior part. Okay, now these breathing holes will actually help the patient to get adjusted to this appliance, because otherwise it will be a very drastic change for the patient who has been habitually breathing from the mouth. So these breathing holes are first given to make the patient comfortable with the appliance, and once he starts breathing partially through the nose, we will start filling up these holes with acrylic. Okay, and this will help to gradually change the patient from a mouth breather to a nasal breather. The second thing that we can appreciate is this metal ring, which is the HOTS modification. Okay, this ring is actually given for lip exercises, okay, or muscle exercises. So here you have to ask the patient to keep the appliance in place, close his lips over it, and try to pull on this ring to try to dislodge it. But he should not allow the appliance to get dislodged. So this will help to strengthen the lip musculature. Now, an important point to note in these appliances is it cannot be given in those patients who have any anatomical or functional obstruction to nasal breathing. So if there is any nasal obstruction because of which the patient is breathing through the mouth, then in those patients these kind of appliances are contraindicated. Okay, so here we can eliminate mouth breathing. Now, between thumb sucking and tongue thrusting, you could get confused because they have similar type of appliances which are used to intercept them. So how will we differentiate is, like I said, we have to see what the requirement is for an appliance to intercept tongue thrusting. So in tongue thrusting, what happens is that the tongue comes and protrudes between the anterior teeth during swallowing. So we need an appliance that is going to restrain the tongue, okay, and then retrain the tongue to place it in the correct position during swallowing. So if you see this kind of appliance or this kind of appliance, here what will happen is that the tongue will be held behind these spurs or these cribs. So the tongue cannot move anteriorly and thrust between the anterior teeth during swallowing. So this is going to help to restrain the tongue, and this will help to retrain the tongue. So what I mean is, here if you see that the anterior part of the palate is not covered by anything. Okay, this is because during deglutition the tip of the tongue should be held against the anterior part of the palate, that's the palatal rugae area. Okay, so if there's any kind of obstruction to this area, then the tongue cannot be placed here. Okay, when we need to retrain the tongue, we want the tongue to be held in the correct position during swallowing. So if you see any of the appliances which are given to correct tongue thrusting, they are placed very close to the cingulum of the upper incisors, okay, because they should not cover this area. Another type of retraining appliance that is given in cases of tongue thrusting is the bluegrass appliance, which consists of an acrylic bead which is given in this area, okay, which will help. So what the patient has to do is he has to roll this bead with the tip of his tongue, which will help to retrain his tongue to be in this correct position during swallowing. Okay, so if you come back to this question, you see that this area that I mentioned that should be uncovered is actually covered by the appliance. So this is not going to help us with tongue thrusting, okay, or interception of tongue thrusting. What this appliance would rather help us with is to intercept thumb sucking habit, because as we know that during thumb sucking, a child is going to place his thumb or his finger over this area of the palate, and the thumb sucking is going to create a negative pressure which will cause proclination of the incisors and contraction of the maxilla. Okay, so when we place an appliance like this, like a tongue grip, which is going to prevent the finger from being placed in this position, we are actually depriving the child of the pleasure of thumb sucking. So this is how we are going to intercept this habit. So the answer for this question, that is the function of this appliance, is a fixed appliance for thumb sucking.